9:23. Welcome back, everybody. It's Ask the Expert. Scott Watson here from Watson's Pharmacy and Wellness Center. Phone calls at 613-789-6559, extension 2803. Email us ottawa.morning@ctv.ca with your questions. Facebook, tweet us questions, whatever works for you. Scott Watson is here. We're talking about medication management, among other things today. We'll get back into that in a couple of minutes. I believe we have some phone callers right off the top. Are we ready to go with our phone calls? Here's Pac calling in today. Morning, Pac. How are you?
Morning.
Good morning. I'm great.
Good. What's your question?
I have a bunch of drugs that are left over from when my husband had cancer. He passed, but I have a hoard of pain drugs. What do I do with them?
Oh, good question.
You know, that's very good. What we, in our pharmacy, what we ask people to do is if you can empty all those tablets and capsules and whatnot into just a little paper bag or something like that.
Right.
Bring them to the pharmacy, and we actually have this mechanism to dispose of them safely. There's a provincial group that will come and take all the drugs from pharmacies.
Right. Does this apply to any pharmacy?
Any pharmacy.
Right.
So we take in drugs just about every day from people that are not using old drugs, expired drugs, or just any kind of drug that's not being used.
Right. Now, when you look at, you look in your medicine cabinet and for whatever reason you have not completed your prescription, which, by the way, is not a smart thing to do. There's that many pills for a reason.
That's right. That's right.
What do you do with those? Same situation if you want to dispose of them? And if in fact it's past the date that it says on the label, specific label, should you in fact throw them out, or are they still good? Or
they could very well be good. But example, an antibiotic that you're supposed to take for 10 days, and some people don't do that for 10 days.
Well, they might get to 7 or 8 days and things have cleared up, right?
That's right. And they might keep it around, and then something else comes along later, a year later, that they might want to use to treat it. But I do always think it's better to start fresh. So go to your doctor and make sure you're getting the right drug for that right indication. So.
Yeah, because you're even though, let's say you're taking antibiotics for something, it clears up, you have some left over for whatever reason, you didn't complete the cycle, and then a couple of weeks go by and the same symptoms return.
That's right.
It's not necessarily so that you should go back and take that medication.
Right. If the first time it didn't work, it's probably not going to work the second time. So start fresh from the doctor and maybe start something new.
Exactly. Who knows? The composition of the whole thing might have changed.
That's right.
Sitting in a pill bottle for
Absolutely.
a long period of time, right? You've got this topic specific to older patients.
Well, so in terms of older patients, our body does change, and that's what this pharmacokinetics is, just an industry term, that how a body moves throughout our body. And as we age, we get more and more, unfortunately, we get more fat as opposed to muscle and less water in our body, and that affects how drugs pile up in our system. So we really do have to manage that. And Beers, this is a woman who put together a group of doctors to look at drugs and how they're utilized.
The person Beers?
That's right.
Right.
And so they came up with a list of medicines that should raise flags to healthcare providers when we're dealing with older patients specifically. A couple examples I wanted to show today. Simple Benadryl. I mean, if you have a little allergic reaction, it's very common for us, someone my age and your age, and children to take Benadryl to take care of that. But someone older, that can have some serious implications. So someone, it can cause extreme dry mouth, troubles with, hallucinations and things like that. So
from Benadryl?
Simple Benadryl.
Really?
And especially if they're taking other medicine.
Yeah. I notice you've got ibuprofen and ASA on here.
That's right. And, anybody with any kind of stomach issue, these are drugs that you really have to be cautious with because they can bring that acidity up in the stomach and cause further damage. So.
And that's, a lot of people overdo it when it comes to ibuprofen and that sort of thing, right?
That's
you have to be pretty careful.
Absolutely.
What's this?
Benzodiazepines. These are the medicines that some people would start to take to help calm them down if there's any anxiety or if they're using it for sleep.
Right.
But again, these medicines, because they last longer in the system, they can cause some rigidity, some hallucinations, and things you just really want to be careful with it in the older patient.
And why is diabetic drugs on this list?
So diabetes is all about controlling sugar, but sometimes we have type 2 type medicines that control the sugars too well, And that means our sugar goes down low, and that can cause fainting, and that fainting can cause a fall, and that fall can do some serious damage to the older patient. So we really want to be cautious with diabetic drugs too.
We'll take a break, but still time to get more questions in for Scott on this topic or anything to do with a pharmacist or pharmacy. Give us a call. One last segment coming up, 613-789-6559, extension 2803. Email us, ottawa.morning@ctv.ca. Facebook questions and Twitter questions welcome. We'll be back with more of Ask the Expert with Watson's Pharmacy and Wellness Center after this.